I want to point out one thing though. The hospitalist is not the intern of the primary care provider. So you don't have a doctor in a clinic building calling you and saying, I think this patient should be on a different antibiotic than you're giving. You don't have the hospitalist calling the primary care provider and saying, hey, can I get a CAT scan on your patient? If that's the model for hospital medicine, you can forget about it. It's not going to work. It just won't work. You have to have the hospitalist in charge. And I'll show this picture. Have you ever seen this movie, Moby Dick? Anyone seen this movie? It's a classic old movie, Moby Dick. And there's Ahab. He's the captain. I like him. Plus, he's got a nice scar. And that's Gregory Peck. A ship only has one captain. Okay? You don't have 3 captains on a ship. And the hospitalist has to be in charge of the patient when they're in the hospital. That a representative, they need to be able to order their tests. And if you have primary care providers who are coming on the floor and saying, don't do that, or calling and saying, don't order anything on my patient until I approve it, hospital medicine is never going to fly. Then that's not a career. You're just an intern for life if that's the case. So if that's how you see your outpatient colleagues see hospital medicine, as you just being their we call it a scut monkey. That's a derogatory term for someone who just does all your paperwork and is not really in charge of anything. If that's all a hospitalist is, then that's not a career that anyone would want to do. So you have to be Ahab sometimes. Of course, you don't want a peg leg. Ahab had a wooden leg, and you don't have to have that to be a hospitalist. And that was a joke. Clinical duties. So what does a hospitalist do during the day? The number one and most important thing is taking care of sick patients. That's what a hospitalist does. But they do a lot of other things. For instance, we have a whole service just co-managing orthopedic patients. That's all the service does. So they come in the morning and they see, and you know, and I love orthopedists and people in the audience who have wives who are orthopedists. That's a beautiful thing. But if you're having chest pain, 2 hours after you've been back on the floor after your orthopedic surgery, who do you want to see you? Do you want the orthopedist to see you who has to leave the OR and say, oh, I'm busy right now. What, chest pain? That's a heart? That's not a bone. I don't want to deal with that. So you want a internal medicine, a hospitalist who can come and see you and take care of you. And so that's what we do. We just help Mayo has such a big orthopedic practice. It's huge. So this service spends this entire day helping the orthopedist with the medical management. If you have a patient who's had a heart transplant and has diabetes, emphysema,